Hi everyone, I'm Dr. Lila Abbate and I'm a physical therapist, and today I'm going to be talking about sacroiliac dysfunction. So here we have a pelvis, and when we look at the two ilia, this is the lumbar spine L5 vertebrae, this is the sacrum, the front of it, and I'm going to just twirl it around. And then this is what we refer to as the SI joints, these areas. And people get a lot of different types of SI pain, and they're thinking about getting something stabilized. One side moves too much, one side's not moving at all. And I just kind of wanted to talk about it only because I feel like it's not really being addressed enough, the sacrum itself and its position to the ilia. And I think that if you sought the help of a good pelvic floor physical therapist or a certified orthopedic therapist who knows a little bit more about the dysfunction about sacroiliac and the causation of pain, that it's a better way than to just go to someone who specializes in hand therapy, or it's the shoulder and they specialize in elbow, whatever it is, or vocational rehab. There's so many specialties within physical therapy these days, so I'm just kind of educating the public on where to really go to get SI treatment. When you're looking at the sacrum itself, it's supposed to sit a little bit forward to the two bones. It's not really supposed to be sitting too far back. And then it moves on a plane of up and down, forward and backward. So sometimes the sacrum will move in a little bit of a transverse plane. When people are sitting in the car, you're rotating to put your seatbelt on. Like your sacrum's supposed to move in the opposite of what your upper body's doing. So then sometimes things get stuck, like maybe you fall down a flight of stairs, you trip and you bang your knee, and then that kind of creates like an upglide of your ilium, and next thing you know, your sacrum's kind of out of kilter and not running on the right axis. So all of these things can get managed and all of these things can get looked at. So as a physical therapist, I'm looking at the bases and how they move forward, backward. I'm looking at the bottom at the ILA and how that moves. A lot of people will misplace this to me and telling me they have coccyx pain, they have sitting pain. And then I say, okay, show me where exactly it hurts you, and they're like pointing someplace over here. And then that's telling me that the sacrum's just not moving well. And you can assess it with sitting, you can assess it in lying, kind of slumping, lying back a bit. And especially people who do yoga, they can't sometimes roll in and out of their position, or they can't roll in their Pilates position, or at the gym. Like they're always getting like some kind of edgy pain at the end or the beginning of their movement. So it's things to look at and think about. So I just wanted to give you some more information about movement of the sacrum. It's just some basics, and how you can get some help with a pelvic floor physical therapist or an orthopedic therapist who can help it or really knows well about the sacrum. So I hope that was informative. See you again soon. Bye.